Hello, everyone, and welcome to the CoROM podcast. This is where academic medicine meets remote, austere, and resource-limited areas. Welcome back to the podcast. This is Aebhric O'Kelly. This week, we're with William Krupa, who just graduated from our Masters of Austere Critical Care program. William, welcome to the podcast.
Thank you, Aebhric, for inviting me onto this amazing platform that you have.
Well, the beauty of it is I get to invite people smarter than me onto the podcast, and I learn every week. So tell us a bit about yourself and what's keeping you busy.
Well, I am currently a paramedic in Northwest Montana. I am doing a lot of pre-hospital education, whether that's wilderness medicine, just ambulance, air ambulance education, and then I do kind of get around and do some military and tactical medicine contract work. That's generally where I find myself these days. And if you were to look at my scheduler, it keeps me pretty busy.
So you teach tactical medicine. What's your background in that?
I was in the military for 4 years, seemingly a lifetime ago. I was infantry. I didn't do anything medical. I was voluntold to go to an EMT course in between a couple deployments I had. And between that and interaction with our embedded combat medics kind of got me interested in medicine. So following service, waiting for other things to happen, I went to the fire academy to do structural firefighting and then EMT and paramedic. And then from there, I made it onto a county SWAT team where I started getting more into that kind of thing. And then that was about 2019. So about since 2019, I've been off and on teaching TC3 courses and then started getting into some more TC3 and prolonged field care and soft medicine and that sort of thing.
So wait a minute, you did EMT in the Army and then you got out and you had to do EMT again.
Yes. Unfortunately, the program that we were in didn't allow us to go take the National Registry right away. I think it was about 4 or 5 months after we had finished the course, and I was burnt out and overlooking at textbooks and whatnot to review. So I didn't end up passing the first time, so I ended up having to take it again.
Did that make it easier the second time, or were you pretty upset and angry that you had to redo it?
Oh, it was probably a good idea for me to go back and take it over again. I don't think at that point in time, my mind wasn't in the right headspace, I think, to actually be effective with doing any sort of medicine, especially at the EMT level. Obviously, we were all trained in that. At that time, it was called CLS, Combat Lightsaber. I was infantry. I was more of a knuckle dragger, trigger puller, as you referred to. So I think it was a good idea that I had taken it again.
I've found that the more times that I teach a paramedic course and I get to sit in the back of the classroom listening to my faculty teach, it makes me better. And not to be honest, I started all of this because I am not smart enough to get all of the paramedic knowledge on the first course, having to reattend and teach again and again and again. Plus 12 courses now I've taught over the years. And every time I learn something new.
Absolutely. Every time that I assist with an EMT class or a paramedic class or wilderness first responder class, I'm always picking up little things, not even just from the other instructors that I'm with. A lot of times it's the students because everybody comes with different backgrounds and education, and even the amount of knowledge that you can gather from somebody that doesn't really have a medical education and just how they may think of one thing versus another. I always learn. A forever student, as we say.
Fantastic. So you mentioned WFR, the wilderness first responder, and there's something magical about teaching the WFR that you get people coming in the door that don't want to be medical, but they're there because they have to. And 9 days later, they exit, and some of them are on fire about medicine. Some aren't, but they still have enjoyed the 9 days. How do you find teaching the WFR?
I absolutely love it. It's an amazing blend between about, I would say, a little bit of EMT level type knowledge and then blending it in with being in the wilderness and outdoors, which is something that I enjoy, especially being here in Montana. And it seems like more time than not, people are always coming up to us after classes and asking how they can pursue more medical education. You know, where's the next step? What else can I do to take this a little bit further and, be better at my job, because a lot of them are hiking guides, like backpacking guides, river guides, and those sort of things. And definitely they usually start off the class because their organization sent them. And like you said, they may not necessarily be excited about medicine, but more, like I said, more times than not, you can kind of see that fire start. So it's absolutely amazing teaching that level of class. It's just long enough to where that fire kind of starts. And like I said, it's just, I would say it's probably just in some levels, it's just shy of the EMT education, but it gives you a little bit more time to go a little bit more in depth. Whereas maybe shorter courses, find myself having to hold back on some things because you just don't have the time to discuss and go into the detail. So I definitely love teaching those types of courses.
Yeah, and 9 days is enough to deep dive in some of the fun topics.
Definitely. And bringing up some of the improvised medicine that I've learned from you and going through the Austere Critical Care program, which I know we'll get into, but definitely for those shorter courses, I don't feel like I get the time to dive into some of that stuff, but because of the longer course, we get to discuss some of those things. So
if I were to look back at the history of the college and all the way back to remote medicine Ireland, and in Ireland, in County Kerry, we were running the Wolfer course. There was the first course in 2008. We were running, because I was teaching bushcraft and stuff. Of course, you got to throw medicine into it. So we did the wilderness first responder, and it got really popular in Ireland and getting more and more people. And then they finished and they're like, what's next? So, well, now we got to create a remote EMT, or as wilderness EMT back then. And they finished that and they said, well, what's next? What's next? And so we had to create the industry paramedic program, which then turned into the remote paramedic program. And here we are. Now we have a doctoral, and you did the master's program, and all of CoROM started with the passion found by people taking the wilderness first responder.
Yes, it's awesome. And I always refer people, if they want to learn more, there's plenty of organizations here in the United States, but I always let them know that I've got my degree, my higher education degrees from CoROM, so I send them your way. Hopefully some of them have taken me up on that, but I definitely think they see kind of what the end product is, and I've gotten a lot of amazing feedback on things that I brought to the table, and a lot of it is techniques and topics and other things that I've gotten from CoROM's programs.
So sure, let's talk about Malta. You've been a couple of times, and just recently you graduated at the Medicine and Mediterranean Conference in January, and we can talk about that, but let's first talk about your first trip to Malta. Tell us about that.
Sure. So my first trip to Malta was for the APUS and ICARE courses. So that was within, I think, the first year or 2 years that I was with college. Again, amazing program, all hands on. You do, I think, about 99% of the learning and course material online before you even show up. And then the entire time we were there, you guys just bombarded us with scenario after scenario, which is definitely, I feel like it's the best way to learn and at least show you how to apply those things that you go over online before. Definitely, I always tell people stories for going through the ICARE, just about all of the scenarios that you guys had given and the moulage and all of that you've done for your patients. It's absolutely fantastic. Definitely put a lot of effort into that, and it shows. And I think it only makes you a better clinician, because now you actually get to practice what you had learned on people and things that look extremely real. Especially I don't know how much detail you want me to get into, but your burn patients were top notch. Probably most realistic that I've seen outside of the real world.
So that is a difficult program to run, and it's my favorite. I mean, I've designed it from ground up to be very much hands-on, but from the back end of it, the 3 faculty and 1 logistician we have to run it is tough. And there's 20 scenarios in 5 days. And we found that, well, I learned by hands knowledge, sitting in a classroom, flying all the way across the world, sitting in a classroom and somebody going click on the PowerPoint makes me cross. So we didn't have that. Well, the 4 PowerPoint slides you have in the whole 5 days are 4 scenarios that I walk you through every morning, so you can kind of see the CoROM way. But we found that you can't have your bum on a seat. You have to be open about and go through these 16 live scenarios and the 4 PowerPoint based scenarios. And in the middle of that, throw you things like my current research on wound vac, improvised wound vac, or other improvised options, or some of well, it is a critical care program, so we do have to throw some critical care skills in there. But I would love to be able to take that as a student, not knowing as I walk in what to expect, because I only got to see the back end. So it's great to hear your feedback on this program.
Yeah, and I can't speak enough about the in-person or even, the online prep up to that. But I think it was a great balance between feeling confident going in and then even first, second, third, fourth day, however long the ICARE was, just walking in, not knowing what you're going to get, and then knowing kind of how the previous day had went. It's, again, you walk into the course and it's like, okay, what does Aebhric have in store for us today? So it kind of puts you on the edge of your seat, and like I said, I think that makes you a better person on the back end, because it directly transfers to what you're going to be doing either in the wilderness or on the helicopter or on the ambulance. You never know what the next call is going to be. So yeah, absolutely amazing.
Before we jump and do a deep dive into the Masters of Austere Critical Care, let's have a chat about your commencement and the Medicine in the Mediterranean conference that you attended in Malta. How was that?
It was great. That was the first conference that I'd been to with you guys, and I'm a return. I will be returning for all the ones to come if I can make it.
Nice.
But absolutely amazing. I took the first workshop that was with the guys from Ukraine talking about blood resuscitation, the drone threats, Raboa, and all of that. And I think that was kind of a nice catapult into the rest of the conference. And then just all of the other presentations that were happening throughout the weekend, Arctic medicine and the product demonstrations, they were all absolutely amazing. I also got to take my WPC, Wilderness Paramedic Certification exam, good old paper and pencil certification exam, but I ended up successfully completing that. So that was kind of the cherry on top of graduating, going to an amazing conference, and talking with everybody who was in attendance.
And you got to have the commencement. So how many times have you marched across the stage to earn a degree?
So that was I suppose if you count high school, I guess that was my third time. I do have a bachelor's that I had gotten in criminal justice and international studies prior to that. So that would have been the next higher degree. So that would have been third time, yes.
So when are you going to do your doctorate?
I am currently actually going back through my thesis after speaking with Dr. Chaba and Ella at the conference. I was talked into possibly publishing some of the research that I had done on my thesis. And then at some point, which I know you guys are putting together a PhD program, if I'm not mistaken.
We have the DHS, a doctorate, but yes, we have submitted a PhD program focusing on publication.
Perfect. So at some point, yes, I will be moving forward with that. I think the first step is getting some of my thesis published, but that is in the near to near future.
Good. So let's deep dive. Let's talk about the Masters of Austere Critical Care. So, William, my first question for you is why? Why did you come to Malta? Why did you choose our Masters of Austere Critical Care?
Honestly, it started, I was out on contract doing some executive protection and then also as a paramedic. And I was just looking for something extra to kind of put behind me education wise. So honestly, I'm trying to remember how I came across CoROM, but once I found it, it was extremely easy for me to make a decision whether or not I was going to jump into the program. I was in a location where I did have some time off. So starting the online portion actually gave me something else to look forward to when I was getting off of shift or off of mission, and just looking through everything leading up to the first day of class, I suppose. It got me excited. It reinvigorated me into medicine, I suppose. I'd been a paramedic for about 4 or 5 years at that point, and think I was kind of hitting that stall period where you are probably overconfident in your abilities and maybe you get a little bored with what you're doing from day to day. So again, after finding the Austere Critical Care program, it kind of reinvigorated my interest in medicine and beyond.
There are tons of master's programs out there and quite a few in critical care. So why did you choose ours?
Well, like I said, just researching CoROM in the background, people like yourself and all the other instructors and docs that you guys employ. Part of what's amazing, or a huge part of what's amazing about the ACC program, is just that there's people that come from all over the world, all walks of life, doctors, paramedics, EMTs, nurses, and they all bring something different to the table. We don't do things the same as somebody may do in the middle of Africa or even in Europe or Australia or New Zealand, a lot of those places. So I feel like that's what sets CoROM aside from everybody else. And one of the talking points that I have when people get interested in CoROM and what you guys do, it's honestly, it's second to none. Just having that experience that you bring to the table with all of your educational persons. Yeah, you can't get that anywhere else. So while there's other critical care programs and degrees, places, I don't think anybody's come close to that. I could be wrong, but at least from what I've looked into in my research, I think that sets you guys well above everybody else.
So as of 2018, I looked around to see what options were out there for a master's degree. So we had the bachelor's, and then, of course, the next step is master's. And there is a pre-hospital critical care program in Norway for paramedics. But their whole concept is, all right, you're treating this guy and 20 minutes you're in a hospital. Okay, now you're done. And that's not what we were looking for. We knew we had to design it from scratch. Thankfully, we had some really smart people. Dr. Chuba is an MD, PhD. He started out his career as a freshly graduated doc on the ambulances in Hungary. So he has tons of EMS experience. He's a doc that gets it. He understands the pre-hospital mentality. It's brilliant. So he helped design this program. I kind of put everything into place and he stepped in and made it much better than I could. So he's the one that wrote the back end, the online. So tell the listener, what was the program like for the essays, the back end, the communication with our MD, PhD mentors?
Yeah, and I guess that's one of the other things that I definitely wanted to mention. So communication between any of the instructors they're super helpful, amazing. Some of the insights that they had in how things would work out in the field, being practical, which is something that I feel like I do pretty well at when I go out and teach, whatever it is. So taking the concepts online that you learn or in a book and basically breaking it down and showing you, but this is how it's actually going to look like in the field. So going through doing all of the assignments and essays, they're all very, what's the word that I'm looking for? They were all very practical. So whether you were doing essays on Ebola, things that are actually going on in the world and basically how would you deal with this or that, and then other critical care concepts, it was all things that I could then leave class or lecture that day and go apply in my own practice, depending on what the critical care topic was. But it was also very nice that, again, with Dr. Chaba and everybody else, even if they were a doctor or an advanced practice person, we were all learning. So it was also kind of nice because I guess depending on where you work, maybe doctors could be held on a pedestal, if you will, and maybe they're not the easiest people to approach, but it kind of brought you back around to where we're all clinicians, we're all in this together, we're all here to help the patients, and they showed that you can chat with them just like you would with a fellow EMT or paramedic, at my level, and it wasn't anything to be afraid of, I suppose. And just the back and forth exchange of information was amazing. No matter what the topic was, they were always open to hearing feedback, discussions, because they knew just as well as we did that it may be different in whatever area of the world that, you or I operate in, and they were always open to hear how these topics actually apply in your realm.
Yeah, we needed the MD PhDs to pick this up and run. And it's not something that me as a critical care paramedic could have spearheaded. Just having Chubba and having Ella, Dr. Sean Bilodeau, who's a EMS doc in Maine, these docs that have done it. They've worked in the front lines pre-hospital and are the ones that are leading you through the discovery process of creating your thesis. So what was your thesis topic?
So my thesis had to do with mechanical ventilation in low resource austere environments. So it basically was focusing on how to provide automatic or automated ventilation, how to extend the life of your oxygen source in your ventilator in that type of environment. It was all something that, as far as mechanical ventilation goes, being a critical care and flight paramedic, the paramedic's always at least in the few organizations that I was in, you were the airway and the vent guy, and the nurse was the medications person. So I've had an interest in mechanical ventilation for a little while at that point. And then as far as where the topic came from, there were a few articles that I came across in the JSOM journal, and that kind of launched me into looking into and coming up with that thesis.
So let's say that you have a presentation and you have 15 seconds to describe the best or one of the main learning outcomes of your master's thesis. What would have that been?
That basically we can provide austere mechanical ventilation utilizing something as simple as a portable oxygen concentrator by simply injecting a rebreather or a closed circuit system that you would have in like anesthesia or diving.
And can that get up to 12 liters a minute?
In some instances it can. So definitely the flow rate and how high you can get your FiO₂ obviously does depend on the respiratory rate and the tidal volume of your patient. But even with some of the research articles that I found, that this is not my concept, this was just something I became interested in. And it has been tested just a couple times. It hasn't been widely researched, but even with a half liter or a liter per minute from a portable oxygen concentrator, you can get anywhere from about 0.8 to 0.9 for your FiO₂ for hours and hours. So as long as you can keep your oxygen concentrator charged, which is another problem and another rabbit hole that I had to restrain myself from going down during my research, it would just be your CO2 scrubber medium, like your Sodazorb or anything like that would need to be changed out. But even then, talking 4, 5, 6 hours till you would need to do that.
Did you look at using two portable oxygen generators and having a T shape or a daisy chain? Or is there any way that you could have 2 6-liter portable oxygen canisters make 12?
Yes. And actually, there were a few different articles that I had come across that they actually did that just without the closed circuit system. So they wired 2 oxygen concentrators into a vent just to see what FiO₂ they were able to achieve. So yes, that is an option. However, being the Austere Critical Care program, I was trying to come up with things that were not super resource dependent. I suppose if you are blessed to have a couple different oxygen concentrators, then obviously you could achieve much higher FiO₂ for those extended durations. I was trying to keep in the back of my mind, though, that you'd probably be limited on equipment, and even if you had one concentrator, you would be considered lucky. But yes, there were a few articles that I came across that did test that. I don't believe any one of them did that with a closed circuit system, but obviously as you bump up your liter flow, then your sky's the limit probably for FiO₂ using one of those type circuits.
So looking at your experience through the Masters of Austere Critical Care, what were some of the challenges you faced on this program?
Well, I know personally for me, time management and depending on what I was doing and where I was in the world. It has always been a challenge for me, and I've never been, I suppose, a great student. So I kind of had to reel myself back in and make sure that I was getting assignments done on a timely basis. But honestly, the program made it easy. It was kind of, go at your own pace. So in that case, it made it easy. It was more just when it came down to the thesis, I kind of had to create my own timeline for things. So that was just a personal challenge, but some people are better at that. But honestly, the rest of the program was great. I didn't really come across too many challenges. Maybe one of the ones that I'd come across that I think we had chatted about as you would do kind of evals as the program would go along was just because we all come from different parts of the world, sometimes syncing up time and getting responses about this or that. Again, just because of time differences and schedules and whatnot. Sometimes those were challenging, but the staff at CoROM and your mentors going through the program really made it a point to answer the questions as best as possible and as quick as possible. So I think that's kind of just an intrinsic type of thing that when you bring in people from all over the world that are still practicing, which I think is key for having people a part of your program doing the education. You got to have people that are still doing the thing. So I think it comes with some of those challenges.
How has this changed your clinical practice?
Well, definitely the immediate change has been in any of the wilderness medicine education. That's kind of a direct corollary to that. And then when I'm out doing your military and tactical medicine and injecting some of the prolonged field care lessons and whatnot, that's definitely a one-to-one type of thing that I can take straight from the ACC program into that. And then just the way you generally think about pre-hospital medicine, that can be applied anywhere from ambulance to an air evacuation platform and even in hospital, depending on where you're at. I haven't worked in a hospital, but definitely anywhere in Montana. We call it frontier medicine out here. So a lot of this could be applicable, even if you do have four walls and bright lights around you.
Nice. William, let me ask you this. So somebody waves a magic wand and you and I change seats. So now I get to live in rural, rugged Montana, right on the border of Canada, being a remote paramedic, and you're stuck in the office as Dean Emeritus of CoROM. How would you change the program? Well, looking at the Masters of Austere Critical Care, what would you want to improve, and what would you put into the program?
Well, I definitely like the way that you guys are moving forward. You've added a whole bunch more courses, elective type courses to the program that I had heard about in one of your other podcasts. So I'm kind of jealous that I haven't had the opportunity to take those, but I'm not sure. I really enjoyed kind of the way it is and how everything's laid out with the ICARE and your APUS courses and all the other things that are offered that students are able to take during the program. I think you guys got a good thing going. I don't necessarily know if I would change much. I will say if we swap seats, you better bring your work gloves and Carhartts out here because you're gonna work. And definitely working in an office is not for me. I just came back from being away for about 3 weeks teaching various wilderness medicine and EMT courses and sitting in my at-home office, and I don't care for it. I'd rather be out doing the thing, teaching the thing.
You were teaching Woofer with Dr. Pearson.
Yes.
Yeah. So tell us how that was. That in Taos or was that in Utah?
So that was in Utah. It was a couple hours east of Salt Lake City where we were. So that was one woofer that I was teaching. And he's putting together an amazing program. Black Swan is the name of his organization. But he had a couple other docs there, and then between me and a couple other people that were from the flight and pre-hospital realm helping out teach the course. It was an amazing program. That was my first kind of foray into teaching a wilderness medicine class. And then since then, I've done a couple other with a few different programs. Everybody has their own flavor on how they do things, but taking a lot of those lessons from the ACC or just CoROM programs that I've been through, they definitely were happy and excited when I would bring some of those things in. A lot of those are simple, not resource intensive. So obviously they were a welcome addition to a wilderness type course.
So, William, what's next for you?
What's next? Well, I just received my I guess just got my FOM approval about a week ago.
Congratulations. Well done.
Thank you.
That is not easy, mate.
No, but it was another one of those things that I started actually at the ICARE. You guys had brought it up. I didn't know much about the Wilderness Medical Society, and I knew nothing about the FOM program, and it was brought up on one of the days for the ICARE, so I signed up, got that started, which was it took a huge chunk out of the required credits, so I'm glad that I did that. But yes, it's been a long time, 3.5 years or so of work. So I finally got that. So I always joke it's more letters to put after your name, and in some instances you kind of you need that just so that people maybe take you more seriously. No, it was an amazing program. Definitely glad that I was able to complete that, and they have plenty of other opportunities to continue and go past the FOM. So planning on doing that. As far as moving forward, I'm going to continue doing wilderness medicine and education. So the WFR, the wilderness first aid classes. I have some TC3 and other classes, contract classes coming up here. And then my quote unquote day job is managing pre-hospital education for a company in Kalispell in the Flathead Valley area. So that'll keep me busy for a little bit.
To be fair, the FOM credential I hold it in high regard. So if I'm looking at what someone published, or if I have, we get applications all the time for teaching, and when I see the FOM, it means something. It's not something you just buy. There's so many crappy fellowships out there that here's a few £100. Oh, great, I've got an F after my name. And there's a lot that aren't by any means, but you have to work for the FOM. And that's one reason why I have jumped through the hoops for 15, 17 years now, working with WMS, making sure that our programs are accredited for FOM, because I believe that having your fellowship with WMS makes you a better, well-rounded clinician in the wilderness.
Absolutely. Yeah, I couldn't agree anymore. And all of the things that you can get approved for credit-wise. And then they have a teaching component, which was actually kind of why I went out to Utah to do the WFR class, because they were offering FOM teaching credit.
Nice.
There's just so many things that they allow you to do and ask of you to get that FOM. It's definitely a process, something you have to keep up with, because they do have a time limit. But yes, I do. I agree. It's more than just paying to have some letters come after your name. You have to put a lot more work into it than that. I agree. It's one of those things that when you're looking at somebody in the wilderness medicine realm and they have that, it's like, oh, okay. And even more so if you're not a doc, I would say. A lot of things for the WMS are sometimes more geared towards your doctors, but definitely if you have FOM and you're not a doc, just all of that extra stuff that's required of you, I feel like definitely holds you in a little bit higher regard. I feel like in pre-hospital medicine for sure. It's been quite the journey going through that.
Indeed. So, William, my final question for you is this. What advice do you have for the new medic, the new nurse, the new doctor who is just starting out in their career in austere medicine?
I would say just continue to learn, listen to everybody who may be speaking in front of you. Also reach out and try to find those people that are doing that thing. This is a passion of yours, being in the wilderness, and you're somebody that comes from the medical field or vice versa. Just keep seeking out information, keep going to classes. It's quite the realm that you're getting into. And just because we learn how to do X thing in an ambulance or in a hospital, it doesn't always work out that way out in the wilderness. So I just feel like, again, being a forever student, and you can always learn from anybody who's around you, no matter student or educator.
That's good advice. And It has been great to have you on the podcast, William, and it was fantastic to shake your hand last January as you walked across the stage and earned a Master's of Austere Critical Care.
It was amazing to do that, and I appreciate everything that you've done for me in the college, Aebhric. So thank you very much again for inviting me on to this platform that you have.
This has been a presentation from the College of Remote and Offshore Medicine. If you would like to earn CPD credits for this podcast, you can join the Council of Members. Being a member of the college gives you free CPD credit, free access to our virtual field guide, and discounts on our e-learning courses. You can join the team on our college website at corom.edu.mt.